We've sort of developed a story that we're telling people now, and just how you get up in the morning and how public health has been at work the night before and all the things that's there for you during the day, and we just sort of put together a story that says, you know, when you get up in the morning, first thing you want to do is go to the bathroom and maybe take your shower, and you get in and you turn the water on and you have good, clean, hot water running for you. That didn't happen by accident. It happened through a combination of partners, one of those partners being public health, who has tested that water periodically to be sure that it's safe and pure, and then just other things. And Jean sort of has a scenario that we use to take you all the way through the day, and she can probably share that with you since her notes are a little bit far away from me.
Well, like Jim said, you get up in the morning and you know, you start your day with the clean water and a breath of fresh air. All of those things are like he said, not by accident, but through partnerships, and we do play a part in those. Then you might be getting ready after you have breakfast, and you're going to take your children to school or to daycare, and you get them in the car and you place them in their safety seats, and hopefully those have been checked by one of our certified car passenger seat technicians, and that's a very intensive course that individuals have to take and pass lots of tests in order to do that job. And in Taney County, we have 4 of those technicians, and we're proud to say 3 of them are staff members with Taney County Health Department. And I'm a great advocate of that. Anyone who has a small child, a grandchild, or you just, you know, move children around in your car as a helper from time to time, you really need to visit one of these technicians and have that checked out for the child's safety. Also, seatbelt safety is probably one of the greatest achievements that public health ever had anything to do with, and it's saved numerous lives through the years. Daycares are inspected, as well as the schools, their cafeterias, their lunch programs. We also help in focusing on nutrition and healthy activities, and making sure that the daycares are free of any kind of lead. After your kids get to school, we work closely with the school nurses, and they're a great partner for us because they can help us identify different, maybe kids are coming to school with a respiratory illness, and as we see that spike, then our epidemiologist and other staff members who work in that area can then begin to track, you know, what is happening in the community. And so we may visit the radio station and send out a public information that says there's this increase, and you need to be aware of, you know, keeping your child home from school, or you staying home from work if you're sick, or increasing your hand washing, being more vigilant about that. So that just kind of takes you up to getting, you know, everyone up to school, and you know, then there's more of the day to go. Another area that people are not as familiar with, that public health works with, is in emergency response. Especially since 9/11, funding came down to the local public health level, and we have been extraordinarily active in any kind of emergency response planning that goes on in the county and the state and locally. And we have found our seat at the table with all the other emergency partners, and we work very in tandem with all of them during any kind of an event. Another example would be if there's a fire in a business. Our environmental public health specialists respond to that just like the fire and the police do, because that restaurant or that business needs to be inspected following, you know, a fire, to determine if that food and drink are safe. And if they are not, they're there to make sure that it is disposed of, and that it's that the facility is then safe to open to the public after that.
You know, we're very fortunate in our county, and the amount of resources that are made available to us by the people here. We do collect a property tax on all real and personal property throughout the county, and we're fortunate in that provides us quite a bit more than some of our surrounding counties. So we are able to do more with that. But what we don't want people to think is that when we ask a question, is, you know, ask someone on the street, you know, what do you know about Taney County Health Department? What do you think we do? One of the first things that they say is that you guys provide services to the underprivileged, to the people who don't have insurance, and we do that. But less than half of what we do is directed toward that population. The majority of things that we do at the Taney County Health Department is for everyone. And behind the scenes is where we spend about half the resources. We have 49 employees with us, and more than half of those people do things that nobody ever sees, or they don't know that they're doing them. When you go into a restaurant, you probably never think that that restaurant has been inspected at least 3 times that year, just on a regular basis. And the same thing with the hotels and the motels. The city of Branson, by ordinance, has a swimming pool inspection program, and beginning right now, we're actually bringing on an extra person, an intern for the summer out of the school over at Joplin, that will assist our staff in doing nothing but pool inspections. And you know, if you take some of the parks that have several swimming pools, it's not unusual, you know, even though they're well trained, for us to have someone at that swim or at that park 2 or 3 times a week assisting them and testing water and all for them. So we just want people to know that more than half the money that they provide for us is used behind the scene and is used for everyone.
In the schools, we have clubs that both, you know, the kids are very actively involved in the Smoke-Free Taney County, in which they work as a peer group and learn about the risk of tobacco, which we all know can lead to chronic illness. And so they're out front doing that. Recently there was the Kick Butts Day, and you know, kind of a side, not a side thing, but a benefit, you know, the kids that are in those clubs, the Dream Big and clubs, they get to come to the radio station and sit with the likes of you folks and enjoy telling the public about what it means to have the, you know, what the risk of using tobacco and starting at a young age. And so they're all about the prevention side as well. We have a website that we would invite everyone to place in their favorites, and that's www.taneycohealth.org. It's a wealth of information, and you know, invite you to go there and look at that, and I think you'll be pleasantly surprised with the information. Public health with you every step of your day.